everyone. My name is Heather Bouchard, and today I have the pleasure of speaking with Dr. Tamara Hunt, who is a professor and Waters Faculty Fellow at Georgia Southern University. Dr. Hunt is a certified athletic trainer and has worked at every level of sports throughout her career. Her research focuses on youth concussion, examining the effects of social determinants of health on incidence, management, and recovery outcomes. She also serves on numerous professional committees to enhance inclusion and diversity in the clinical and research setting. Dr. Hunt will be speaking at the upcoming SNS Symposium, giving a talk titled Every Brain Matters: The Impact of Social Determinants of Health on Concussion. Dr. Hunt, thanks for being willing to speak with me today.
Thank you so much for inviting me.
So, to begin, can you share how social determinants of health shape who gets diagnosed and treated after sustaining a concussion?
Oh, that's a tough one to start off with. But really, we're talking about access to care. And unfortunately, we know that there are medical deserts, there are access to care issues when we look at our lower resource and lower socioeconomic status patient population. And so a lot of times the question is not only do you have access to even a primary care physician, but do you have access to someone that is trained and or knowledgeable about concussion, TBI, and that mix? And so we know that there are some major disparities. I currently live in Statesboro, Georgia. Our poverty level, we are 37%, 37% of our population is in the poverty level, and we don't have access to a trauma one healthcare center. And so when you start looking at those things, when we have issues with traumatic brain injury or even just trying to figure out what is going on after the consequence of a concussion, getting access to the appropriate healthcare providers, getting access to even the local providers that might be able to give us referral plans out tends to be a little bit harder in those low resource areas. And so when we think about who gets diagnosed after concussion, honestly, a lot of times, unfortunately, if you don't have those allied healthcare professionals like athletic trainers, like physical therapists that are on the sidelines or at the sites or close into the schools or the systems, then we don't have the appropriate referral system set up to get them into that primary care facility that can then further their treatment. So what we tend to see is we tend to see affluent, very well, high health literacy people and patients that are getting access to care where those that English is a second language or any of those other factors are going to play a huge role in whether or not that they can get access to care, diagnosed and treated appropriately in a timely manner.
Yeah, that makes a lot of sense with just a lot of the barriers that we see when people try to go and navigate the healthcare system. Are there practical steps that you can think of for those clinicians that are listening to this right now on what they can do to make their care more accessible to those who aren't able?
I think first we have to start with understanding and recognizing our own implicit biases. I know that when I worked in the high school setting, I had athletes that, let's call a spade, right? You have some patients that aren't necessarily your favorite. Right. And so we may start thinking, oh, well, they're just complaining because they don't want to run, or maybe they're just trying to get out of something. And we have to make sure that we are recognizing that we might come from a place of privilege. We may come from a place where it's like, it's no big deal to go and drive my car to the healthcare provider and get whatever healthcare I need. And that may not be the case for everybody and everyone. And so understanding one, that most people want to get help. Most people want to get better. Most people are not going to fake these things. Most people are not going to try to milk the system or anything like that. Most people want help. And so I think if we start from that perspective and then we start asking questions like, what are some of those barriers that might prevent you from coming into the clinic? What are some of those barriers that might prevent you from seeking additional care or obtaining additional resources? If I'm an athlete in the high school setting or in the school setting, What might be some of those barriers to get some of the accommodations that I might need to be successful in school? If I am in a food insecure environment, right? Like we might tell another student, hey, we want you to stay home so that you can rest your brain. But if I'm in a food insecure environment, I need to go to school so that I can get breakfast and lunch. So understanding what those things, honestly, having a conversation with your patients is going to be the first way to start to understand what they need so that then we can actually give them what they need and support them while they're recovering from the concussion instead of just kind of assuming that these things are already in place and they're going to happen. Understanding what resources they may need that they may not even be aware that they're available, and just having that conversation and really getting at the heart of what is it that you need that's going to make you successful and not assuming that it's already there and it's in place, I think is what the biggest thing that clinicians can do to kind of mitigate the inequities.
Yeah, it sounds like really meeting patients where they're at and not assuming that, all patients or their parents are able to travel to where clinics are located or take that time off of work. Is there a role that you see in telehealth making clinics more accessible?
I do. As an athletic trainer, we don't often do telehealth, right? Because we are typically boots on the ground. We're right there, we're right next to our patients. But I definitely think that telehealth can be an important factor. Um, but again, you also have to understand that some patients may not have access to appropriate telehealth facilities or telehealth opportunities. Like maybe they do or don't have internet access at their home. And so then they still have to go somewhere to get internet access to then be able to have the telehealth visit. But yeah, I think that telehealth can be a huge intermediary to help navigate transportation issues. I know some areas are working with their patients and they have protocols where they'll pay for an Uber into the
Wow.
clinic to support those that are lower resources and don't have access. In Statesboro, Georgia, we have limited bus systems. We don't have public transportation readily available. So if you need to go into Savannah, which might be an hour drive, on top of having to take off time from work, having to, right, the transportation may not really be accessible. And if that's the closest physician that you have to get care for this specialized issue, like it's just those things. And so I think that as clinicians, we can put in some things in place. Telehealth is a great way to start. But also being creative in the resources that you have in your community. So maybe we don't have a great bus system, we don't have public transportation, but perhaps I can get them on campus. And on campus, we can get them to other satellite sites so that they're getting one-stop shopping, or utilizing our nursing students to put on clinics so that they don't have to pay the copay if they go to the doctor. So just kind of making sure that we are utilizing what we have available and that they know that those things are available. Like, do we have a free clinic available that they can go to maybe every Saturday, every Tuesday night to make sure that we are navigating that system? I am here, in Georgia, and so obviously church and religion is a really big deal. So can we set it up so that when maybe their parents are going to Bible study on Wednesday nights, we have nursing students, we have athletic training students that are doing clinics at some of the churches so that the student athletes can get some additional support and some additional help. So, and I know our College of Education has set up some things where they do tutoring during Bible study. And so, like, is that something that we can do? So, even if telehealth may not be the best answer or the only answer, like, we can figure out other resources within the community to say, hey, we're here for you. Because I think a lot of times we miss the idea of like, everybody says, like, they don't care how much you know until they know how much you care. And I don't care where you are on the spectrum with socioeconomic status or where you are in the spectrum of access and ability and financial wealth and all of those things. If you truly care about your patients and you truly care about your population, that is going to hit home so much harder. And then they're willing to listen to you. They're going to understand what you're doing. And then they're going to see that all the things that you're doing to help them and support them is something that you really, truly mean. And I think that speaks wonders in our communities.
I think that's a lot of really great examples for those listening to really think about how to be integrated more within their community to really have that bigger outreach and have that creativity. There's a lot of these pieces that you already touched on with the systemic issues on, food insecurity, rural areas that people live in, just that inaccessible care. And you touched on a bit of those, but are there other ways that you hope the field broadly of sports neuropsychology will move to try to reduce some of the systemic inequalities that a lot of these underserved patients really experience?
I think from a systemic perspective, we I think that's probably one of our bigger problems because I think that most of us look at this top-down approach to healthcare. Um, I am being asked to bill more frequently, see more patients, work smarter, not harder, just get those manpower things in. And so to ask someone to, and all of the other things that they are doing to stop, take a breath and talk with your patients. Like time is the biggest factor that we have that we can't really navigate well. And so, from a systemic standpoint, I think that if we can make it easier for clinicians to sit back and say, how can I assess this? How can I quickly assess this and still get to patient care and still get to support everybody? So some of those things are going to be easy things like, do you have a checklist of like, hey, do you have transportation? Do you have food in your home? Are these things that can lead to some of the symptoms that we're looking for concussion recovery? Um, and then, honestly, just from an upper administration standpoint, what training are you giving your fellows, your residents, your clinicians, your staff on how to navigate working with other people that might not come from the same background that you come from? Again, implicit bias training is going to be really important. Making sure that, but again, honestly, just making sure that everybody is aware that these are some barriers and everybody can say, okay, I understand that I may not have this barrier, but you may have this barrier. So let's figure out ways that we can work through them to kind of navigate that system, I think is really important. And then finally, I think being able to have the resources right there in front of you within a click or two is also going to help because a lot of times, one, we don't know what resources are available to us. But then once we do know what resources, if they're really hard to get to, very few people are going to use them. And so, from a systemic standpoint, if we can identify those struggles, identify those barriers really easily, and then be able to say to connect the patient with the resources that they need to help them very quickly, I think those are probably the biggest ways that we can, from a systemic approach, kind of at least start to mitigate some of these issues. We're not going to get them to go away. You don't have to solve every single problem in your environment, right? We can't do it all. So, lean on your community, lean on everybody involved because this should be an everybody problem, not just a patient problem, not just a clinician problem, not just a clinic problem. This is your community. So, get your community involved and make sure that everybody says, yeah, we care about this. And so, we're going to put our money where our mouth is. We're going to support it and figure out how we help.
Yeah, I think there's so much more that we can just keep learning and learning from our patients as well. Well, Dr. Hunt, thank you again for being willing to speak with me. And I really look forward to learning more about the impacts of social determinants of health and how we can meet our patients where they're at the SNS Symposium in Cleveland this May. For those who are listening, you can read more about the conference and register to attend at the SNS website, which is sportsneuropsychologysociety.com. You can also follow SNS on social media. Thank you so much.
Thank you.